What if a medication already approved for obesity could also help people stop binge drinking? This surprising possibility sparked a new clinical trial. Here is the paper itself. Alcohol use disorder, or OD, affects millions worldwide and is responsible for about 5% of all deaths each year. Before this trial, treatment options were few. Approved medications target different pathways, and behavioral therapy remains essential, yet many patients continue heavy drinking. Clausen and colleagues asked whether once-weekly semaglutide could meaningfully lower heavy drinking days in people also struggling with obesity. The trial randomized 54 participants to semaglutide and 54 to placebo, each receiving weekly injections and identical CBT sessions. Heavy drinking days were measured using the timeline follow-back method, while secondary outcomes captured broader health impacts. The investigators used rigorous statistical methods, ensuring that the results reflect true treatment effects despite some dropouts. Semaglutide reduced heavy drinking days by 13, 7 percentage points more than placebo, a statistically significant benefit, p equals 0.0015. This forest plot style figure from the paper visualizes the primary outcome, highlighting the clear separation between semaglutide and placebo. Beyond the primary endpoint, participants on semaglutide consistently drank less, craved alcohol less, and showed better liver enzyme profiles. The authors observed that participants who lost more weight also tended to have larger drops in heavy drinking days, suggesting a linked mechanism. Semaglutide was generally well tolerated. Side effects were expected for GLP-1 agonists and did not lead to major safety concerns. These findings suggest that clinicians could consider semaglutide as an adjunct to behavioral therapy for a specific subgroup of patients. While promising, the trial's scope is narrow, and larger, multi-center studies are needed to confirm the results. Future trials should broaden the population, extend observation periods, and explore how semaglutide stacks up against current standard pharmacotherapies. In short, semaglutide shows meaningful reductions in drinking and related harms for patients who are also managing obesity. These 3 rules can help clinicians integrate semaglutide into routine AUD care safely and effectively. For patients, the message is hopeful. A once-weekly shot could address 2 health challenges at once with manageable side effects. This trial marks a milestone, linking metabolic drug therapy with addiction treatment in a rigorously designed study. We appreciate the investigators for advancing the field and the Lancet for sharing these important results.